Welcome, everyone. I'm very excited to get us started on the number of different assignments that you'll be working on as part of your group project for this semester. The remainder of the assignments will focus specifically on a single company, Panotech LLC, and the many different challenges they're experiencing with information systems. Today, I have the esteemed honor of speaking with the new CEO of Panotech LLC. She has recently taken on the task of turning this organization around amidst a time of crisis and added scrutiny. Bem-vindo, doutora Adriana da Silva.
Obrigado. Thank you very much for having me here today.
Now, Panotech is an exciting opportunity, but for someone with your credentials, we know you could have taken a position in a much more stable environment, one not filled with the many challenges that we see at Panotech. Could you tell us a little bit about your background and why you think that this particular opportunity was right for you?
Well, I received my PhD from Johns Hopkins University in biomedical engineering with a specialization in stem cell therapy for regenerative medicine. And originally, I wanted to start my career as a medical doctor because I wanted to be part of patients' lives and, being able to save people every day. But as I started to do more of research in the biomedical engineering area, I realized that I could provide doctors with a lot of these cutting edge technologies that could potentially be able to save a lot more lives. And so I realized that my impact could be there much greater. So I had a family member that had a lung issue due to smoking, and the doctors couldn't figure out a way to help her. And so I wanted to try and put to work my research and to see how the stem cells react to nicotine and ways to regenerate the cells. And so I was able to help her by using periodontal ligaments to regenerate the stem cells in her lung. And for me, that was just a moment where I realized that even though we want to abolish completely smoking, it was a way for me to make my imprint on her and save the lives of those people that want to, start their lives again by using some cutting edge technology. And I wanted to dedicate my life to that.
Wow, thank you so much for sharing that with us. We can tell that you're truly passionate about that cause. You're also a distant relative of the founder, Paulo Lima dos Santos. How much of a problem do you think this will be in your new role at Panotech?
I don't think it will be a problem. I think that it's something I'm very knowledgeable of the inner workings of the company. I've had the privilege of working with a lot of the individuals that started the company, and I have their respect. And I think that it will definitely help me because I will have their support in moving this company forward.
And we know you've already assembled a number of special teams that are going to be working on some of the challenges there at Panotech LLC over the next few weeks. Could you tell us what specific areas that they would be focusing on, or tell us a little bit more about that idea of forming these teams?
Yep. So it's been long known that information systems hasn't been one of our greatest strengths in this company. Despite our many successes, there remains a disconnect between our various locations and record keeping. So one of the things that we want to do is make sure that our information system is up at the level where a company of our stature should be at. So we have the industry support, and now it's time to make sure that we're reaching those levels.
And I have the privilege of serving as one of the members on a special team that Dr. Adriana has formed. My area will be one of consulting to ensure that some of these things are approached in a way that will truly have the greatest impact. But are there any specific areas that you could share with our group at this point?
Certainly, I can touch on a few of those points. Firstly, the electronic health records is an area that's it's very important to us. Many of our systems have the capability of using these functions. However, we aren't currently adopting them. So it makes us difficult to implement when our teams aren't adopting to these systems. Another area we will be looking into is new computer systems, mobile device security. As you're aware, we have a very large sales force that's on the road, so mobile security is going to be key for us. And social networking is something that we definitely need to tap into. And lastly, I think we need to explore our potential in robotic surgery and continue to push the limits in biomedical engineering and taking this company to the next level.
Wow, thank you so much for sharing those insights with us. Some of the topics are really on the cutting edge, and we're really looking forward to see how these special groups bring about changes in Panotech. We will have the opportunity to talk with you again, and we're really looking forward to that so we can review the results of some of these changes that have taken place.